Hello, everyone. This is question 26 of our 100 clinically oriented anatomy questions. Let's get straight into it. The question says a 55-year-old woman is admitted to the emergency department after her automobile crash. Physical examination reveals that the patient's foot is everted and she cannot invert. The weakness in dorsiflexion and inversion of the foot is noted. Her ipsilateral patellar reflex is reduced in quality. Although the Achilles tendon reflex is brisk, knee extension is almost normal as all are hip movements and knee flexion. Sensation is greatly reduced on the medial side of the leg. Which of the following nerves is most likely injured? Femoral nerve, L4 spinal nerve, L4 and L5 spinal nerves, common fibula or the common peroneal nerve, and the tibial nerve. So, which of these nerves um, is most likely injured? So, I've underlined out the important things that we need to take notes. Okay, so also we need to take note of this too. So they said the patient's foot is everted and she cannot invert. There's weakness in dorsiflexion and inversion. Then our patellar reflex is reduced in quality. Then there's a loss of sensation on the medial side of the leg. So all this is pointing towards a particular thing. And what is it pointing towards? Let's analyze this one after the other. So let's start from the foot eversion and inability to invert the foot. So the spinal nerve that is responsible for controlling the foot inversion is actually the L4 and the L5 spinal nerve. To be more specific, the L4 spinal nerve. So the L4 spinal nerve is it is the major spinal nerve that controls the inversion of the foot. It is just supplemented by the L5 a bit. So we have L4 here. The next one, they said a patellar reflex is reduced in quality. So the patellar reflex is used to test the integrity of the L2, L3, and L4 spinal nerves. The L2 and the L3 gives the motor innervation, while the L4 gives the sensory innervation. So L2, L3 gives the motor innervation, L4 gives the sensory innervation. So the basically what they are discussing here is the sensory innervation. So the sensory innervation is lost, is reduced in quality. So it's safe to say that the L4 spinal nerve is actually affected. Then let's continue. They said the sensation is greatly reduced on the medial side of the leg. The medial side of the leg is cutaneously innervated by the L4 spinal nerve via the saphenous nerve. So yeah, so all this is pointing towards the same thing, which is the L4 spinal nerve injury. So if the L4 spinal nerve is injured, the patient will not be able to invert since the inversion is controlled by the L4, majorly by the L4 and a bit by the L5. The patellar reflex is reduced in quality. Patellar reflex is majorly controlled by the L4 spinal nerve, right? It is used to test the integrity of the L2, L3, and L4. But the L2 and L3 gives the motor, while the L4 gives the sensory. So it is the L4 spinal nerve that is affected. Then reduction of sensation on the medial side of the leg, supplied by the saphenous nerve, which is through the L4 spinal nerve. So all this is pointing towards option B, which is L4 spinal nerve. And that is our correct answer. So option B is our correct answer, and the other options are wrong. Femoral nerve is a nerve that innervates the anterior compartment of the thigh, and they are responsible for knee extension and hip flexion. The L4 spinal nerve is also just analyzed. So the L4 and the L5 spinal nerve now. Let's go back to the question. They said the knee extension is almost normal. Knee extension is almost normal, as are all hip movements and knee flexion. So knee extension is controlled by the L4 and the L5. The L4 is affected, the L5 is not really affected. That is why it is almost normal. It is not totally lost because the L5 is still giving a bit of sensation to it. So the L5 is still supplying it a bit to an extent. So that is why it is not totally lost, because the L4 is already affected. The L4 the L4 is already affected. The L5 is still working. That is why it is almost normal. Same with the hip movement. The hip movement is majorly controlled by the L5 and the S1. The knee flexion is also majorly controlled by the L5 and the S1. So that is why all these things are still normal. Okay. So it means L5 and L5 spinal nerve is not the correct answer. The common fibula or the common peroneal nerve. The common fibular nerve bifurcates into the deep fibula and the superficial fibular nerve, and that is why the foot can be everted. Yeah, they said the patient's foot is everted, which means the superficial fibular nerve wasn't affected, because superficial fibular nerve supplies the lateral compartment of the leg, which is majorly responsible for eversion. So it means the common fibular nerve was not affected. The tibial nerve controls controls plantar flexion and controls flexions of the toes. The question also mentioned that the Achilles tendon reflex is brisk, which means the Achilles tendon reflex is normal and it is very sharp. The Achilles tendon reflex is mainly used to test for the S1 and the S2 spinal nerve, specifically the S1 spinal nerve. So it means the L5, the S1 spinal nerve is still normal. So it means the plantar flexion is still normal. So that is what the Achilles tendon reflex means. It means the plantar flexion is also still normal, which means the tibial nerve was not affected. So the correct answer is the L4 spinal nerve. I believe you understand, and I will see you in the next episode. Thank you.